Thank you, Bob. Well, the FDA is forcing Johnson & Johnson to throw out millions of vaccine doses made at a plant here in Baltimore. WJZ is live. Paul Gessler on the FDA's reasoning and how many doses were actually approved. Paul?
Denise, the FDA for months had been reviewing and testing the doses of those J&J vaccines made and manufactured here in Baltimore. Regulators say that they are not ready, they say, to authorize manufacturing again at the East Baltimore plant.
The FDA says several batches of the J&J vaccine made here in Baltimore need to be tossed. The New York Times reporting that number totals 60 million doses.
It's obviously very tragic that an additional 60 million doses will have to be discarded because of the problems at this plant at a time when there's this huge global shortage.
The Emergent plant has been closed for 2 months. An FDA report released in April shows a number of issues at the plant, including the design of the building, improper medical waste handling, peeling paint, black and brown residue on the floors and walls, and poorly trained staff.
We have to scale up manufacturing, but that needs to be done very, very carefully.
A source tells WJZ 10 million doses were authorized. The FDA approved 2 batches of the vaccine Friday after a review of the facility records and quality testing.
By taking such an action, FDA is really helping restore the public's trust.
Johns Hopkins professor Dr. Ting-Long Dai says the move restores public trust. He says the implications will be felt worldwide as the facility had hoped to manufacture 1 billion doses.
That's huge, but it looks now that's not going to happen.
The company's CEO told Congress last month quality control measures worked.
The production lot was quarantined, set aside, and never left our facility.
Experts say there's still a strong argument for using the vaccine, including the FDA's extended expiration of the drug by an additional 6 weeks.
That makes it much easier to kind of get that vaccine into remote areas, and obviously it's a single dose.
Now, the FDA says those approved batches, again totaling about 10 million doses, can be used here and in other countries. It is still reviewing additional batches made at Emergent BioSolutions. We're live tonight. I'm Paul Gessler for WJZ.